Hello everyone. Our today's topic is fluid and electrolyte disturbance, and we have to do the post-operative day 1, and our case is appendectomy. Here with me is HAUWA. She will be the another doctor, and here is our patient. He will be performing patient VISHAL. So now we have to take the vital signs of the patient. Before that, you have to ask some subjective information from the patient, like do you feel diarrhea? No. Do you have vomiting? No. Are you a patient of diabetes mellitus? No. Okay. And how is your abdominal pain? Do you feel it?
Yeah, a little.
In a scale of 1 to 10, how much it is?
It's 4.
Okay, fine. The pain is 4, as the patient has said us, that the abdominal pain is till 4 points. So now we will start taking the vital signs. For vital signs, first of all, I will start with the pulse. So for pulse, I will just hold the patient's hand. I will just move our finger to the radial artery. I will count the pulse. And while that, I have to even check the respiratory rate without making the patient know that I am checking the respiratory rate. And we have done the pulse and the respiratory rate. Now the second thing is, I have to check the consciousness. For the consciousness, I will check the responsiveness of the patient. At 4 a.m. when the surgery is just done, just have the surgery, there will be not much responsiveness because of the anesthesia. After that, as the day passes on, after the time, the consciousness will be same. So for that, the patient does not respond as actively because it's 9. I have mentioned it in the Excel sheet. Now in the next step, we are going to measure the blood pressure of the patient by sphygmomanometer and using a stethoscope to hear the pulse. Now I am measuring the blood pressure of the patient, and as we have to put it in the Excel sheet, so this is the blood pressure of the patient. Now in the next step, I have to examine the patient's skin and mucous membrane. For the mucous membrane, I will check it in the patient's mouth. I will ask him to open the mouth and I will see if there is any damage in the mucous membrane or not. And the skin is pale and moist. Actually, we have the patient of appendectomy and the skin is pale and moist.
Now we will take the body temperature using mercury thermometer. So the patient will put it under his armpit. The temperature is normal, 37 degrees Celsius.
So today, 31st October 2020, we had a patient at 4 a.m. We did this surgery for appendectomy, and the supervisors were Naman and HAUWA, and now we are filling the Excel sheet. The patient's name is VISHAL PATIDAR. So we are filling it. At different times we did different examinations and the sheet shows the same. Like at 4 a.m. the surgery was done, then the patient was transported to PAU, then PW, and these are the different times of the units that we took for the vital signs. And then there's the subjective info, like we have asked him, did you feel thirsty, vomiting, diarrhea, does he have diabetes mellitus or any bleeding anywhere? And we have asked him about the abdominal pain. According to the information we got, it has 4 points. And after that, we have done the vital signs. In vital signs, we first took the pulse rate. The pulse is 90, 90, 90, and then at 11:45 it was 80. And the respiration rate, it was 18, and then 16 at 11:45, the same. There was no mechanical ventilation. The blood pressure was 130/80 in the early morning just after the surgery, and then at 11:45 it was 120/85. The consciousness in the morning, like just after the surgery, was 9 because the patient had anesthesia, so because of it the consciousness was low. After that, till 11:45 it reached 15. That's good. Then the temperature was 37, normal. Go.
For the NPO, we are giving him 2,800 ml of crystalline solution intravenously. So at first you have to tie the tube here. You should palpate the vein and insert immediately after fixing the needle. You should remove the belt and start the flow of crystalline solution. For intravenous access, we perform IV cannula after the surgery. There is no hemorrhage and no dressing state at the site of the surgery. There is no vomiting, no drain loss, and there is no any NG tube. There is no NG tube and no one drain after the.
Now it is a sample of the urine took from the patient. Now we will do the urine analysis. Some of its sample is given to the laboratory for the checking, but it is a urine analysis done by the doctor, and I have to fill it in the Excel sheet.
Urine observation. The color of urine is transparent at 4:45 and it is 200 ml. And at 11:45 the color changed to light yellow and it also changed to 400 ml. There is no change in concentration and there is no presence of stone and blood and there is no any catheter used.
Here is the diet of the patient, like the way of nutrition and fluid supplement. It is not given by mouth. There is only NPO diet for till 11:45 for the post-operative case for 1 day. We can see there is NPO diet till 11:45, and after that there is this is again of date 31st October, the post-operative fluid chart. For it, the patient's weight is 80, and after that it is multiplied to 35. For 24 hours, 2800 ml is given. For next 12 hours, 1400 ml is given. For next 6 hours, 700 ml is given. And for the next 3 hours, 350 ml is given. So here it is the complications, the conclusion for the complications. There are no complications, hopefully. Then next is re-examine. We have re-examined the patient after 15 minutes at 4:15, then 30 minutes, then after 1 hour, then 2 hours, then 4 hours, and at 6 a.m. lastly. The dressing is changed once a day because the wound is in inflammative phase. There is no mobility, there is no activity of daily livings. For the computing intake and output in ml, the intake is not done by mouth, we know it. The intravenous input is 2800 ml, it is measured in ml. The output is by urine, it is 1340 ml. Here is the local status of the patient. At 4, the abdominal pain was 4 points after the surgery. At 4 it was 4 a.m. it was 4. At 5:45 it was 4, and at 7:45 it was 4. And there was no distension, no flatulation or gases, no peristalsis, no stool. And the conclusion is the patient is getting better.